Thank you very much. I'm from Korea and I am a founder of Talos. Our motto is we prevent the preventable. This means we are making some softwares to identify the risk of a preventable disease. As a professor neurosurgeon, I worked in the university hospital for 10 years. I do many surgeries for cerebral vascular disease patients. But I lost so many patients due to the cerebral hemorrhage. So I decided to make some technology to identify the risky patient before they can get any big accident. Nowadays, many patients' journey is starting from symptom appearing. They go to hospital and making some chance of a diagnosis and get a treatment and be cured. But some kind of disease doesn't have any symptom and undetected lasted, and with a sudden accident, very disappointing results are caused by the death and disability. This is called brain aneurysm, a balloon-like bulge in a blood-brain vessel. It is like a balloon. It is very easily enlarged, and the weakest point is prone to rupture. And this rupture makes cerebral hemorrhage called subarachnoid hemorrhage. This is very most fatal strokes among all kind of strokes. So we call this as a ticking bomb. Many famous figures are known as cerebral aneurysm victims. Even previous US President Joe Biden was an aneurysm patient, but he was lucky to diagnose the early chance and have a chance to treat early and have been a US president. The fatality of SH is over 50% all around the world. But even worse thing is that the survived 50% fall into very severe disability like a coma or hemiparesis, something like that. So that's why we are focusing on this disease, because if we find brain aneurysm earlier, before rupture, we have many options to treat it clearly. The cure rate of unruptured aneurysm is over 90%. So the matter is to find earlier. The problem size is 2%. It means 1 or 2 in this field would have unruptured aneurysm already. This means there is about 1 million patients in Korea and about 2 million patients in France. Fortunately, in Korea, there is a government-curated database regarding to the healthcare checkup. About 1 million patient data we can gather to train our AI algorithms. And these patients are followed for 9 years, and so the big data size is 9 million person-year data. And we trained it, and we find some clues to identify the risk of cerebral aneurysm. This is with the way we decision. This is not a diagnostic. This is just a risk assessment tool for cerebral aneurysm. So the high or highest risk group should be recommended to get a MR scan. All we need to calculate the risk is 21 variables. This is very simple measurement data and very simple blood test data and some kind of questionnaire data regarding to the family history of some disease. Using this data, our model can calculate the risk of cerebral aneurysm very precisely. The actual prevalence of highest risk group shows about 7%. 7% means 7 in 100 would have aneurysm, which is most fatal strokes. And we can find it earlier, and we made a chance for early treatment. In other words, if we make a chance to do MR scans for high or very high risk group, we can find potential 80% of all aneurysmal patients in these groups. And also our model is validated using UK Biobank data, which is consisted with 99% of Caucasian, and the size is 500,000. And the result of the validation is very promising. And overall, the calibration curve shows the very positive relationship with the risk and the real prevalence of the cerebral aneurysm. Our first client is just a healthcare checkup hospital in Asian countries, Korea, China, Japan, and Vietnam, Taiwan. they can get more revenues from with our software because they can operate their MR scans or CT scan very effectively, and they can have a willing to payness to our company for our services. And our second business model is related with the insurance underwriting system. We innovating this underwriting system to provide a very precise tool to assess the risk of a very severe cerebrovascular disease. This is the status of our global expansion. We are trying to get a CE marking and MDR approval in Europe market, so that's why we are here. And this is a real report of a patient to be diagnosed aneurysm and get a chance of early treatment. And she fully recovered and enjoyed her second life. This is a QR code for our product. And thank you for listening. If you have any question, I'm ready to get it. Thank you.